So if you've ever been told that you needed a pessary or you've been doing some research about it, pay attention for the next 10 minutes because we will be talking about vaginal pessaries. Hi guys, I'm Dr. Peter Aziz, urogynecologist and pelvic surgeon. Every day I see patients with prolapse, incontinence, who want a simple treatment for their problem and they refuse surgery. They did some research online or they've been talking to some friends or someone told them, hey, what about a pessary? However, they've been hearing some bad stuff about it and they're a little bit concerned. So today we're going to be breaking down some of the biggest pessary myth. Before we dive in, if you have any personal questions about your own pelvic health, general health, sexual health, I offer a one-on-one health coaching session. The link is in the description below. Feel free to book a session with me. Now, let's get right into it. So what is a pessary? A pessary is small, removable silicone device that we place inside of the vagina to support the bladder, the uterus, basically the pelvic organs. And we usually do this for pelvic organ prolapse. Pessaries can also help with incontinence, especially stress incontinence, which is leakage of urine if you cough, sneeze, laugh, jump, exercise. Pessaries have been used in medicine for over a century, and they still remain one of the first line treatments for prolapse and incontinence, according to the American Urogynecologist Society. So the first myth that we're going to talk about is pessaries are only for elderly women, which is absolutely incorrect. It's one of the most common misconceptions that I hear in my clinic. The truth is, pessaries are appropriate for women of any age, including women in their 30s, who have prolapse, let's say after childbirth, want to avoid surgery, or still planning to have future children or pregnancies, or simply they are not ready for surgery because surgery is not reversible. However, a pessary is. So for a young woman who wants more children, a pessary can manage the symptoms now, and surgery can wait until childbearing is completed. And age has nothing to do with that. It's basically depending on your own goals and what you're looking for in the future in terms of your treatment. All right, myth number 2, that you cannot have sex with a pessary. This myth stops a lot of women from even trying or considering a pessary. So here is the reality. There are a lot of different pessary types. There is something called a support pessary. There is something called a space-occupying pessary. The later ones are usually pretty large, and those are the ones you cannot have intercourse with. However, the first ones, the support pessaries, you can actually have a satisfying sexual life with the pessary. It's kind of like the Nuva ring, just a little bit more rigid. If it bothers you, then you can actually remove it and you can have intercourse and then you can replace it again. I have a lot of patients, they are able to independently remove and reinsert their pessaries without any difficulty. It's kind of like inserting a tampon or a menstrual cup. So sex doesn't have to, be given up because you have to have a pessary or you have a prolapse. No, you can absolutely have intercourse, either with pessary in place if it's not too uncomfortable, or you can remove it, have intercourse, and then reinsert it. Myth number 3 is a pessary will cause infections. So that's not true. What can happen is most women, they will actually have increase in vaginal discharge with the pessary. However, discharge does not automatically mean that you have an infection. This is usually just the vagina's normal response to having a foreign object present. Similar to how your body reacts if you have a ring, like a contraceptive ring or an IUD. What actually causes infections and irritation is neglect. So with pessary, it requires maintenance. What does that mean? It means that it has to be removed, reinserted every once in a while. Usually, I tell patients to come see me in the office every 3 to 4 months. We take the pessary out, we look inside of the vagina, make sure everything looks good, there's no complications, no bleeding, no ulceration. Everything is looking good, we reinsert it again. If there is a problem, then we leave the pessary out, allow the vagina to heal before we place it back in. And you can also avoid all of that if you can remove and reinsert the pessary by yourself at home, like, I don't know, once a day, once a week, even once a month. Okay, myth number 4 is once you start using a pessary, you'll need one forever and you can't get rid of it. Keep in mind, the pessary is a tool, not a life sentence. And it is not a treatment for prolapse. A pessary just gives you some support to keep things up so they don't fall out. It's something to help you, get through pregnancy, finish childbearing, or a bridge until you get, for example, another treatment options like surgery. Even if you decide to choose a pessary long term, you're doing this because it's working well for you and you do not want surgery and you don't have complications from a pessary. So you don't have to have the pessary long term. If you choose to, that's your decision. But you don't have to because there are other options. Okay, myth number 5 is pessaries don't actually work and surgery is the only real fix. This is like the most damaging myth of all because it stops women from even trying a non-surgical options. Some of them, they go to the doctors like, hey, you got prolapse, we have to operate right away, we have to do surgery. And no, you don't have to. Also keep in mind that number 1, prolapse, it is not dangerous at all. It doesn't affect your health in any way. It's a quality of life thing. So even if you have prolapse and it doesn't bother you, you don't have to do anything at all. Just leave it alone. And 80% of patients with prolapse, their prolapse is going to stay the same. It's not going to get any worse. Only 20% of the time the prolapse gets worse. So if you don't want treatment, you don't have to. Also, a lot of the research that we have show that majority of women who are properly fitted with a pessary, they report significant improvement in prolapse symptoms like a bulge sensation, a pressure sensation, or even incontinence. And a lot of women, they report satisfaction level compared to surgical outcomes without the recovery time, without the risk of anesthesia, without the possibility of needing a repeat operation in the future. Surgery absolutely has its place, and for some women, it is the right choice. But you have to make the decision, and it shouldn't be the only choice you're offered. And a pessary isn't like a prize for women. It might be like an actually better fit for you. So let's say, you have a lot of health problems, heart disease, lung disease, strokes, blood clots, and you are high risk for surgery. I would not recommend surgery at all. I would, tell my patient, you can absolutely do really well with a pessary. So it's not about your age. It's not about like what you have to get done. It is about your health and your personal preference. So bottom line is pessaries are safe, effective, reversible, and they are appropriate for far more women than most people realize. Regardless of age and sexual activity, whether you've had children, whether you've been told you're too young or you're too active or that a pessary would not really help, get a second opinion for sure. Get proper pessary fitting if this is what you're interested in, and try it out. There is really no harm in trying a pessary and see how it works for you. If you like it, perfect. If you don't like it, at least you tried and it's not a good option for you, and then you can consider surgical intervention. Hopefully this video helped you clear things up, gain more knowledge on pessaries, treatment options for prolapse. If you like this, please subscribe to my channel, hit the thumbs up. I put videos every week about women's health, pelvic health, and sexual health without confusion, without embarrassment. Drop comments below. I try my best to read all of them. And feel free to book a session with me if you have any further questions. Thanks for watching. I'm Dr. Peter Aziz.